International migrants, including immigrants and refugees, compose a significant proportion of the population in countries that serve as frequent migratory destinations. So for a long time, Canada has been one of these countries, and currently about 1 in 5 people in Canada are foreign-born migrants. And it's no surprise that Canada is one of the most ethnically diverse, developed countries in the world. And I do personally believe that this is what makes Canada amazing. But what does this actually mean for Canada's healthcare system? When my family were recent immigrants to Canada, we were desperately searching for a general practitioner who spoke our language. We had neither friends nor relatives upon arrival, and accessing healthcare was great stress in times of urgency, especially when you have a family member with a complex medical history. Many times, we felt lost and isolated. And as a child, one of my fears was one day having to go into emergency surgery with a doctor who didn't understand us or know our complex medical history. Fortunately, no one in my family had to go through such experience, but it still gives me a light shudder when I imagine such situation for someone else. So now that I have comfortably settled after about a decade or so, I reflect back to my experience as a new immigrant to British Columbia. And truth be told, it wasn't the quality of medical services, but the non-medical aspects of healthcare that truly burdened my family. There are several barriers. First, the language barrier, and second, the turbulent transition from the healthcare system of my birth country to that of Canada. Although we had physically immigrated, it took a long time and much effort for us to feel at home as patients in the new healthcare system. So what is my hope for healthcare? My hope for healthcare is to break the remaining barriers to healthcare access for the culturally diverse patient population toward a more accessible, holistic, culturally sensitive healthcare system for everyone. And I see this hope as one that has been long instilled as a healthcare mission on paper, but that is not exactly actually received the spotlight for extensive action within the system. Yet this concern will not diminish on its own, and even seems to grow in my eyes more and more. In the recent years, for example, the war in Syria has been a large source of forced migration in the world, and the number of refugees has increased dramatically. As refugees continue to arrive, there's much concern over how Canada should accommodate these migrants over the next years in terms of healthcare. The vulnerability of migrants to various health problems associated with migration concerns us all, especially when around half of all refugees are children. Public opinion toward refugees is a mix of support and concerns. Some may think, oh gosh, it's too much of a burden to other countries. Not my country, other people can take it. And maybe some of us are supportive. But fundamentally for us, the question is, can we accommodate the healthcare needs of refugees when we are already struggling with our existing demands? And we all know about the struggle we have, right? And what types of healthcare services will be crucial? And we all know, what impact will this have on our healthcare system? Can we do it? And can we do a good job? These are the types of questions we constantly ask ourselves. And as a health sciences student, I feel rather positive toward the integration of refugees into our society and the healthcare system. And this is a conclusion based on my perceived capability of our healthcare system. Although refugees do have supplementary needs that are unique to forced migration, the barriers they experience in healthcare are not very different in nature than what every vulnerable population in Canada, such as new immigrants, experience. It's also important to note that there have been many improvements in the past years, especially in terms of resources for new immigrant patients. A translated guide to Canadian healthcare system, or the number to a medical interpreter are some important tools in navigating the healthcare system here in Canada. I have personally seen several friends and family take advantage of similar resources. They are truly useful. But I want to talk about something else, beyond the language barriers and tools for the patients. Hopefully we can advance to challenge ourselves by asking questions like, what more can be done for these patients? And how can we better understand the diverse patient population? In the context of Canada, a good starting point to improving the quality of healthcare may be migrant healthcare training for professionals. Such training could be available to all professionals in the healthcare sector working with immigrants and refugees to improve care at various levels, both structurally and clinically. Providing professionals with the training to better understand the lived patient experience of migrants, as well as what makes them vulnerable to health problems, will be one way to address the issues we currently face in multicultural Canada, and possibly prepare us for the global refugee crisis. Eradicating barriers to healthcare access may sound like a very distant goal, but I feel hopeful that we can gradually achieve the best here in Canada. If we listen to the experiences of patients and recognize the need for action, we can improve healthcare. Thank you.